to forensic and the community medicine, those things, the additional subjects quickly as soon as much as possible for the relevant component related to your main 4 subjects, right? So here we are going to discuss several single best answer type questions. Those are not new to the people who go through our single best answer questions. There are 100 questions. So anyway, these are the patterns. So here I add some different type of single best answer type questions to then you all can be familiar with those questions. So when it comes to the exam, these are the modern type of questions they are going to ask. These are the practical issues rather than those old theory parts. So these questions, all the questions are practical questions where either you are going to face as a doctor or a colleague or a doctor with other medical professions, where the practical issues you can get this type of patients, you have to face these type of incidents with while you are working with other colleagues, your co-interns, your co-doctors, and those people, right? Question 1. You are an intern at a medical ward. Your co-intern was found to have used alcohol before he went to the ward during his night on call at the quarters. What is your next best management? So, your co-intern, he is the one who is on call tonight. So, before going to his on call, he had some alcohol. So, what is your management, right? Ignore the incident as it is his matter. No, at this moment, you can't ignore it. This is a matter for your හෙටවෙද්දි ලෙඩ්ඩු ටික මැරලා හිටියොත්. So that's a matter of yours. So though you can't ignore it, right? The alcohol consumption by a person is not a matter of yours, but when it comes to this type of co-intern, co-doctor who is on call tonight, even though not on the intern, after post-intern, so this can happen. So that is a matter of yours. So you can't ignore it, right? So that answer is false. So remember that there are false answers as well as true answers. So you have to find out the best answer, right? Call the hospital police and inform. Not false. Sometimes if he is arguing, he is coming to attack you, so you have to do the preventive steps. So this is a late step, but it is not false, right? Discuss the incident with other interns. Yes, you have to do it, right? It is true, not false. Report the incident to your consultant. Yes, that's true, right? We'll go up to now. It's a good answer, right? Wait to see if he repeats the behavior and inform your consultant. Let's say if he is repeatedly delaying in the morning, right? The intern, your co-intern is after having alcohol, next day is sleeping up to 8 a.m. and he's coming to the ward around 9 a.m. So he's repeatedly late. So that kind of incident you have to discuss with him, and if he repeats, you have to inform. But this one, you have to directly inform your seniors, either the SHO or your better to inform SHO, better to inform your senior doctors, then through them transfer the message to the consultant. But when it comes to this question, they are only giving as report the incident to consultant. Yes, you can discuss with the interns. You can discuss with your SHO, then inform the consultant. So that's the best answer for this question, right? So if it is no, they will not ask from you that type of tricky question. Inform the SHO, inform the consultant. So that is discuss the incident with SHO, report the incident to your consultant. Then you are in a tricky situation. So that will be a MD level question, not up to you, right? So these type of basic ethics. So this is basic ethics. That's why they are asking from you. If you know the basic, you can answer this exam. This is a exam where they are checking your basic knowledge, not the postgraduate knowledge, right? So they will not give that kind of question. They will give this type of easy question. So you have to get the best answer, report the incident to your consultant. That means the seniors, right? 2. A 20 years old newly married female came to the hospital with abdominal pain. She is diagnosed with appendicitis. The surgeon who carried out a laparotomy under general anesthesia find that the appendix is inflamed. Appendectomy was successfully performed. The surgeon noticed a large number of multiple cysts in her bilateral ovaries. At this point, the surgeon's best next course of action would be which of the following, right? So there's a patient, married female, came to the hospital with abdominal pain. You are intern there. They diagnosed appendicitis. While doing the appendectomy, they found that the ovaries are there are cysts, right? Remove the patient's ovaries immediately in the best interest towards the patient. It's a kind of best interest action, but it's not a life-threatening condition. So you can't do that, right? Let's say if it is a uh, kind of a arterial ligation, while accidental cut or there's a kind of congenital anomaly and arterial uh, tear, you have to do that. You have to tear that without getting the consent, but that is because of the immediately you are saving the life. So this is not a kind of life-threatening condition. So that is false, right? Take biopsies from both ovaries during the surgery. That is not this much harmful, but this is also false. Why? If you go to the pathology lab, if you go through those where usually they are taking the biopsies from the thyroid and those things, you have to get the consent before the biopsy, right? So if you go through those things, you know that you must know that taken a biopsy mean to take biopsies, you need the consent, right? You can't take biopsies and say I saw inside there's a kind of these things, maybe a carcinoma, so that's why I think. So you can't do that, right? That's false. Seek permission to exercise the ovaries from the patient's husband who is sitting in the waiting room. This is not an emergency. So this is okay. Let's say during a cesarean section, there's a continuous bleeding. The VOG's opinion is hysterectomy. At that time, you can, with the best interest of the patient, you can get the signature from the husband. It's a kind of additional, for the additional safety, you can get the husband signature and go for it. Not this type of thing, right? For a multiple cyst. There's no any potential threat, right? So that is false. If it is comes as hysterectomy and emergency cesarean section, continuous bleeding, so that this will be a good answer then, right? Request a gynecologist to attend to the surgery and give specialist care immediately. No need immediate care, right? If the gynecology VOG is there, you can get the opinion about when the gynecologists are there at the same theater. Just we are in a practical situation. We ask, so what is this? Then that's a kind of not harming the ethics and not even though the show in patients these ovaries and the internal organs are so kind of a non-ethical thing, but you can get an idea Anyway, you don't need any immediate action from gynecologist, right? Once recovered, discuss with the patient and refer to gynecologist, right? So easy. See, don't think too much. Don't try to uh, give the fullest potential to the patient. So in generally, you treat the patient while you are going to do the වැඩි හොඳ කියන්නේ අපි වැඩිපුර හොඳ කරන්න ගියාම තමයි කියලා වෙන්නේ. So I have taken biopsies කිව්වම patient will go to the courts, right? So uh, once recovered, discuss with the patient and refer to gynecologist, right? How to pass the ball, right? So that's the best way. So don't think too much in generally what you are going to do. Don't think too much. Don't do too much to anyone, right? To the patient, that's also, right? Don't don't go and do that kind of things like where there's a bleeding immediately patient is coming with bleeding and you need immediate surgery and arterial embolectomy or kind of a surgery. So not like that, right? So I am saying this generally, this is life non-threatening. There's no harm for the life, and you can do it in a later time. So that is how you have to do it. Without consent, you can't do. You only taken the consent for the appendectomy, right? Once recovered, discuss with the patient and refer to a gynecologist. This type of question you can get in your OSCE station also. They will give this kind of scenario and ask what are the ethical and moral ethical principles related to this and what is your medical legal management. Those kind of questions they can ask, right? Third one, a 75 years old man accidentally fell on the floor. He fell backward and hit his head. After 20 days of the incident, he developed headache and alteration of mental state. What could be the most appropriate cause of this? As we discussed, we discussed in our head injury one also. We discussed this in previous questions also, where intraventricular hemorrhage can be, but less, right? Meningitis, yes. Subdural hematoma, yes. Vertebral artery tear, that is sudden EDH, SH, and death, no 20 days. Epidural hematoma, no 20 days. That is, there's a lucid interval, and you know those things. We discussed those things in our head injury lectures. That is not 20 days. So the alteration of mental states usually comes with subdural hematoma. Meningitis can be with the intraventricular hemorrhage, but less percentage than meningitis and subdural hematoma. Here, more the age is 75, so the higher chance is subdural hematoma. These two, the answers A, B, C are correct. Out of those things, B and C are the best one. From those things, you have to take this one. If they mention as fever and fever, then something with kind of meningitis, they can give towards meningitis, like the patient can see the bright lights and those things. So rather than the backward fallen, let's say the impact to the face or the chin, or that may be the because of the base of the skull fracture, and from there's ascending infection that goes to the meninges, and that cause meningitis. So that is comes with that kind of answer, that kind of clinical scenario. This one is more towards subdural hematoma, right? So the answer is answer C. So both are correct. From that, with this clinical scenario, you have to take subdural hematoma. Same scenario, they can give the, rather than the backward fallen, they can give the fallen and hit the chin, and the patient complain of uh, ear pain or something. That is because of the base of the skull fracture. And then there's a redness around the back, right as left side of the face, and swelling, and patient having fever, and there are kind of photophobia, and patient difficulty in seeing bright colors, that type of things comes with meningitis, right? So here the clinical scenario is much more towards subdural hematoma, right? Okay, next one. 4. You are working as a doctor in a sexually transmitted disease clinic, right? Give me a second. 1 second. Sorry, I got a call from another road traffic accident related questions. Okay, right. Um, okay, you are working as a doctor in a sexual transmitted disease clinic. A male patient has newly diagnosed with HIV. He requested that you do HIV, you do not inform his wife about his diagnosis. What is your next best step in management? Immediately inform his wife without his consent. Respect his wishes and maintain complete confidentiality without further action. Counsel the patient on the importance of informing his wife and encourage voluntary disclosure. Refer the case directly to the public health authorities without counseling. Discharge the patient from the care due to risk to others. So, in this type of question, this is a simple question, you know the answer. These two answers are false, right? You can't send without counseling, that is false, and you are not sending directly to the other authorities because there's a you have to keep the patient's confidentiality uh, with you. You can't divulge those informations directly, right? Discharge the patient from care, that is false, right? That is easy. Immediately inform to his wife without consent, also false. You can't do that, right? Respect his wishes and maintain complete confidentiality, that is also false. Why? Here this is a sexually transmitted disease and it is a HIV, so it is you can't uh, you can't do that. That if the patient is when you are repeatedly asking the patient to disclose the message to the your his wife. If he is not doing, you have to inform, right? So, but when it is newly diagnosed, then counsel the patient on the important in wife and encourage voluntary disclosure. If you are repeatedly asking him to disclosure this, if he is not doing, you have to inform the wife, right? So this is the change comes with newly. If it is repeatedly you are asking and the patient is not divulging the information, then this can be correct immediately, not immediately. Inform his wife without consent is as best interest toward the society. That is the answer, right? So remember the difference. Even though this is a simple question, when you are in the exam stress, you will feel that something else. So remember that these are the keywords here: newly diagnosed, right? So repeat even your repeated counseling. So that type of are the key words where you have to uh, go through those things very much concernedly, right? 5. You are a doctor in an emergency treatment unit of a rural hospital. Police brings a patient from the bus stand who is experiencing generalized chronic convulsions. After appropriate treatment, the patient recovers and informs you that he is a bus driver. He requests that uh, you do not divulge any information about this to his about his illness. Otherwise, he will lose his job. What is your next best step in management? So he's a bus driver, right? So there's a thing, um, there's a issue uh, where there's a threat to the society, right? He's a bus driver, right? Respect his confidentiality. Remember, the this is important. Bus driver means the important thing here, right? Respect his confidentiality and allow him to resume work without informing authorities. That is false. You can't do that. You have to do something. At least you have to do something. Immediately inform the bus company about his medical condition without consent. That is immediately inform. That is correct. But without consent, that is issue, right? Counsel the patient regarding the risk of his condition to the public safety and encourage voluntary disclosure to the relevant authorities. So that is uh, right. Up to now, this is the best answer, right? Report him directly to the police for unsafe driving. You can do this. This is also not false. Why? If he is repeatedly having convulsions and you are asking him to divulge information he is not doing and repeatedly driving the vehicle, so you have to inform, right? Discharge the patient without any further. That is false. This is true. This one is the best one. Immediately you have to inform, but without consent. So that is the issue. So even though he is not giving consent, sometimes you are repeatedly asking him to inform the relevant authorities. If he is not informing, you have to inform, right? When it come to the here the if the this comes as repeatedly informing, bus driver comes to a clinic with the chronic convulsion history, then immediately inform the company even though he's not giving consent, right? So remember those things, right? Who gave answer here? Roshini Piris. 4 is C. 4C. Yes, right. Okay. 6. You are a surgical intern at a surgical ward. Here we are just discussing these different type of single best answer questions, right? All are different patterns. Each and everyone has a different pattern. This is also another pattern, right? You are a surgical intern at a surgical ward. There's a 20 years old patient. There's a 20 years old patient with a multiple injuries following a road traffic accident. Which injury pattern best indicate that the patient was a motorcycle rider? So we discussed, you all know that we discussed in our lecture notes where the injury patterns. In that we discuss how to identify a motorbike rider, how to identify the driver, how to identify the front seat passenger, back seat passenger, what are the airbag related injuries and the pedestrian injuries and those things we fallen from height, everything we discuss, right? So you have to remember that. So there are sub answers. See, multiple grace abrasions, nasal bone fracture, collis fracture, right? Multiple grace abrasions, chin lacerations, nasal bone fracture, collis fracture, clavicle fracture, nasal bone fracture, hinge fracture of the skull, tibial wedge fracture, multiple grace abrasions, chin lacerations, hinge fracture of the skull, right? Everything is there. So you have to remove one by one, right? Multiple grace abrasions. Grace abrasions are abrasions occur in the bony prominences and the prominent areas with the tangential force with the broad rough surface, right? So that is the graced abrasion, grace definition. We discussed those things in our injury lectures. Then nasal bone fracture. Usually the nasal bone fracture is not a you are not taking it as a prominent area. Nasal bone is there at the kind of uh, I don't tell that it is unlike it is cannot be happen, but unlikely, right? When you are discussing about the motorbike rider, we are not usually discussing about the nasal bone fracture, right? There are yeah, other than nasal bone fracture, there are some usual pattern of injuries, right? Multiple grace abrasions, yes, with the moving force, patient fallen on the ground, bony prominence areas, you can get multiple grace abrasions in multiple directions, right? So this is correct. Nasal bone fracture, this is usually with the assault, right? If a punch, if a fisted hand, and assault. So those kind of things are the related with nasal bone fracture rather than motorbike rider, right? Collis fracture, yes, true. The forward projection and keeping the hands that can cause the force transmitted here. Yes, that's true. So this one correct, this is false, this is correct. Multiple grace abrasions, chin lacerations, nasal bone fracture. Multiple grace abrasions correct. Chin laceration, yes, forward projection, the chin can hit. It can go transmit the uh, force to the base of the skull where the hinge fractures of the skull can happen, right? Chin laceration is the manifestation for the external manifestation where there can be a hinge fracture of the base of the skull. Nasal bone fracture, then multiple grace separation, that is true. This is true and this is false, right? Collis fracture, yes, true. Clavicle fracture, yes, true. Why? The force transmitted, then from here to here, the clavicle can be fractured, right? Nasal bone fracture, then false, right? This is true, true, false. Nasal bone fracture, false. Hinge fracture of the base of the skull, yes. Motorbike rider, that is tibial wedge fracture, that is false. Why? Tibial wedge fractures we discussed in our injury pattern lecture. Tibial wedge fractures are usually found in the pedestrians, not in the motorbike riders, right? Where the bumper fracture, that is called bumper fracture, where the bumper shell of the vehicle, the front part of the vehicle usually hit on the around the knee joint area, right? So this is false, this is true, this is false, right? Multiple grace abrasions, chin lacerations, hinge fracture, everything related to motorbike rider, right? Here, one, this is correct, this is false, this is correct, this is correct, correct, false, correct, correct, false, false, correct, false, correct, correct, correct. So the answer is C, right? So that's how you are going to elicit the answer. Otherwise, if you see everything, this is you can think whatever, everything can happen, right? Everything can happen in a motorbike rider injuries, but the usual pattern is this, right? So we discussed those things. We how the injury patterns in fallen from height, what are the injuries in airbag related injuries. They can ask what are these other injuries. Then if you know the pattern, if you go through those basic patterns, so you can answer well. They will give kind of these are the airbag related injuries. True, false, true, false. That's that type of questions. If you know those theories, you can answer, right? You are an You are an ETU on-call doctor. A 27 years old man who was involved in a motorbike accident is brought with a polytrauma. On examination, you confirm that the patient is died. After informing the family, they started shouting and becoming aggressive. What is the most suitable next best step in management, right? This is a if you go through those recent uh, news, this was happened in Bandaragam or somewhere, right? This is that question, right? Where the death confirmed, then they hit the hospital properties and they get the body and went to Panadura hospital or somewhere, right? This is happened few, I think 2 months back, right? Call hospital security to remove the family. You can do it. That is true. Leave the scene to avoid escalation. Yes, you can. True. Stay calm and allow the relatives to express their emotions. Yes, true. Shout back and assess the authority. Sometimes you have to do it. You can't say that is false. That is true. Ask the nurse to deal with the situation. Yes, if you can't deal with the situation, if the nurse can shout well, you can ask nurse to deal with the situation. So all the answers are correct, right? So out of these things, what is the best step? Call hospital security to remove the family. Let's say this happened to us. So that what we are going to do? Leave the scene to avoid escalation, right? Stay calm and allow the relatives to express their emotions. Shout back, not nurse, not you the scene, not hospital security. So the best answer is you have to take this, stay calm and allow the relatives to express their emotions, right? Out of these five, this is the best answer, right? I'm not going to say this is the perfect answer, but when the practical situation comes, you have to deal with all these methods. But uh, as you are doing the theories and the exam for the exam purpose, this is the best answer, right? Okay. 8. You are an on-call doctor at a OPD at an OPD in a rural hospital. A driver following a road traffic accident was brought to you to determine whether he was under influence of alcohol. He is conscious, rational, and he has state of smell of liquor, right? He denies any head injury or history of use of antihistamine tablets, right? But he complained of pain and tenderness of both lower limbs following the accident. What is the most likely group of tests that determine whether he was drunk or not? You know, we discussed those things where the alcohol and the forensic aspect of alcohol, there are where we discussed 2 or 3 lectures and we discuss about the management of how the guideline of examination of drunkenness, right? So according to the guideline, there are several tests. Out of those tests, here the patient is complaining of he's having um, both lower limb tenderness following accident. So you have to do the other tests which are not related to the lower limbs, right? So for that, you have to know what are the tests, right? What are the tests? What are the tests related to the examination, right? And he is conscious and rational. Remember those, these are antihistamine or no head injury. So those are important points here, right? Breathalyzer test, we are not doing breathalyzer test. Romberg test, that is also you if you know the theory, you can go and read those things. It is related to something to lower limb. One leg stand test, again lower limb, right? One leg stand test, you can't do it. Ruler drop test, you can do it. That is reaction time. Romberg test, again standing one, right? Lower limb, yeah, involved, right? Horizontal gaze nystagmus, yes, you have to check. You must check the horizontal gaze nystagmus, not the vertical nystagmus. Horizontal nystagmus. Romberg test, then again false. Finger nose test, you can do it. Horizontal gaze nystagmus, ruler drop test, finger nose test. Yes, this is true, 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 right? Horizontal gaze nystagmus, true. One leg stand, that is false. Breathalyzer, you are not doing breathalyzer, that is police post. Police people are doing, so that is false. This is false, this is true, right? So remember, this is true, this one true, this is true. So that is the answer, right? Answer D, right? These are the type of questions you can get. These are easy direct questions, right? 9. Regarding the medical ethics, which of the statement is wrong, right? Remember this. Another type of single best answer type questions. Uh, there are four uh, correct answers, and there's a one false answer. Other way is also there. There are four false answer and one correct answer. So they are asking the wrong answer. Statement is wrong. So the wrong one is the correct answer here, right? In a medical emergency of a child, the doctor can ignore the parental objection. Yes, that's true. We discuss in our ethic lectures where the best interest toward the patient. Sometimes in an emergency, you can ignore the parental objection and proceed with the uh, whatever the intervention. Then the law will protect you, right? The doctor, because doctor did this because of the best interest toward the patient, right? So in a medical emergency of a child, the doctor can ignore the parental objection. True. So true. So that is not the answer, right? We are going behind the wrong answer. Okay. Once a child become a competent adult, she can sue her parent guardian for refusing to give consent for the treatment, which result in serious physical damage and causes permanent physical disability. Answer is true. We'll go to other things and check whether there are any uh, wrong answers, right? Sorry, this is again, see, this is true, right? This is true, then we are going behind the wrong answer, right? Okay. The custody, remember that in your exam situation, you will think, this is true, so this is the answer, right? But that is not the answer, right? Okay. See, the custody can be transferred from a parent to fit person under uh, Child and Young Persons Act. Yes, that's true. We discussed those things in some situations where the custody we have to transfer to a fit person. Like, let's say the mother is having a kind of severe psychiatric illness that should be treated with keeping a mother in a mental hospital or somewhere. So because of that, legally we can transfer the custody, right? That is under Child and Young Protection Person Act. No consent needed for psychiatric examination under Mental Health Act. That is also correct. Even though a person is having mental illness, you have to take the consent. But when it comes to the Mental Health Act, that is a special circumstances where no need the consent, right? In civil medical negligence, the patient or their next of kin has to go to the High Court for the damage. We discussed those things where Sri Lanka Medical Council, we discussed a separate lecture, we discussed the medical negligence, we discussed the serious professional misconducts, everything. There we discuss civil and criminal medical negligence. There civil cases go to the district court and the compensation courts rather than going to the high court. High court is deal with usually with the uh, deal with the criminal medical negligence, right? So this is false. Because of it is false, they are asking the false answer. So the answer is this, right? Okay, this is the answer. Okay, remember that, right? When they ask wrong answer, you will think this is correct. So this is, don't take it as they are trying to make you make that mistake from you, right? The following injuries were observed in a patient who came to your surgical ward following a road traffic accident, right? So this is another type of question. You have to read everything and go to the answer. Answers are here. This is just a clinical scenario. Multiple graze abrasions on the back of the elbows. Back of the elbows. Think back of the elbows, right? Left side periorbital contusion, right? Contusion and subconjunctival hematoma. Left side frontal lobe cerebral contusion. Okay, right? 2 to 1 centimeter side subcapsular liver hematoma, right? Left side clavicle fracture. Okay, right. What is the most important medical legal opinion to be expressed into the courts, right? All the injuries are due to blunt force trauma, multiple grace abrasion. Yes, abrasion is blunt. Contusion. Yes, blunt. Contusion, blunt. Hematoma means again blunt. Fracture. Fracture can be cut or broken with a blunt force. So the left side clavicle fracture means again blunt. All the injuries are due to blunt force trauma. Yes, that's true, right? Injuries are grievous under the category of hurt. Injuries are grievous. No, or not all injuries. This is grievous. This is more than grievous. That is, there's a existing threat. Subcapsular hematoma, there's a existing threat. This can be rupture and patient can be die. So there's a existing threat. Marine chance left side cerebral contusion. Cerebral contusion again. Again. Wait. Right. Sorry. Cerebral contusion again, endangering life. There's a existing threat for these two endangering life, right? Left side periorbital contusion, subconjunctival hematoma, those are non-grievous, right? Not grievous. Multiple grace abrasions, back of the elbow, non-grievous. So you know those things, how to categorize. We discuss those things separately. The category of hurt is separate lecture, right? What is the most important? So the injuries are grievous under category of hurt. There are injuries grievous, there are non-grievous injuries. So that is false. Findings are compatible with the vehicle of a driver, with the vehicle driver injuries. We discuss those things, how to differentiate the driver, how to differentiate the front seat passenger, back seat passenger, motorbike rider, pedestrian, right? So these are not compatible with driver injuries, right? So you know those things, how to differentiate, right? So the findings are compatible with the vehicle driver. These are not usual injuries, I mean, right? These can be, everything can be there, but these are not usual pattern, right? The highest category of hurt is endangering life. Yes, this one grievous, this is endangering life, this is endangering life, this is non-grievous, this is non-grievous. So the highest category of hurt is endangering life. Yes, that's true. Subconjunctival hematoma is grievous under limb wave. Subconjunctival hematoma is non-grievous. It is a contusion. It can absorb, but subconjunctival hematomas are, there are two types. One is there you can see the lateral margin of the subconjunctival hematoma. That means that is because of the direct blow. If the lateral margin is, you can't see the lateral margin of the subconjunctival hematoma, that means that is come from the base of the skull. There can be a base of the skull fracture or orbital roof fracture, right? So those are the causes for the second type of subconjunctival hematoma where there you can't see the lateral margin, right? Subconjunctival hemorrhage is grievous under limb wave. That is not non-grievous and that is not grievous under limb wave, right? The usually not grievous. There are kind of rare scenarios, so those are not for you. If this is a postgraduate question, you have to think uh, deeply, but you don't think that much of deep, just basic. So subconjunctival hemorrhage is grievous, that is false, right? So the this answer is correct. This is false. This is false. This is correct. Out of these two, the most important one is this one, right? This is also important, but the most important one is this. Both are correct. The gravity, let's say this answer is, let's say 60%, this is 70%. So that is because of that, this is the answer, right? So remember that this is another type of question. You are an internet medical medical ward, right? A 54 years old male bedridden patient was treated for bilateral lobar pneumonia and died after 10 days. The patient was bedridden for 7 years following a road traffic accident. There is no suspicion for or any complaint from the relatives. Your registrar orders to you to give a cause of death of lobar pneumonia and issue a death certificate. What is the incorrect statement regarding this clinical scenario and management? Right. Patient, 54 years old, bedridden for 7 years following and died because of pneumonia for 10 days. Patient was bedridden for 7 years following road traffic accident, right? So you are giving a DC and sending the without a postmortem, right? So what? Incorrect statement. Again, incorrect one, right? Should be investigated by an inquiry of sudden death. Yes, that's true. Remember, this is a famous clinical scenario where when you are doing medicine appointment, you will treat him for the pneumonia and you are giving DC and send the body to the with the relatives. But this patient was bedridden or something. The pneumonia happened because of a road traffic accident, right? Because of 7 years before. So don't do that. Get the detailed history, go through the history, why he is bedridden. When the bedridden patient comes, first check what the history, what has happened previously, why he is bedridden now. If it is a kind of a trauma or something, should go to let's say fallen from height or somebody assault or somebody road traffic accident, everything will be there because of the for the bedridden. So you have to go through the history and check whether this one is a this is a kind of case where there will be a legal issue or not, right? So if it is a legal issue because it is RTA, right? So you must send this for an inquest, right? Should be investigated by an inquiry of sudden death. Yes, that's true. The cause of death is not completed. Yes, that's true. Why? Lobar pneumonia. That's lobar pneumonia due to prolonged bedridden due to road traffic blunt force trauma, right? So that's that is the correct cause of death, right? This is lobar pneumonia itself is not enough, right? That underlying causes should be there. The cause of death is not complete. Yes, true. So they're asking incorrect. The death certificate should be not have been used. Yes, that's true, right? Autopsy is mandatory in this scenario. True. As the cause of death is natural cause, no need an inquest. That's false. Why we discuss the highlighted points are here, road traffic accident, right? Bedridden for following road traffic accident. This is the most important part in this history, right? Read these things. Let's say within 30 seconds, you have to go through the question and highlight the important points, right? You can highlight those things. 54 years of bedridden. Then you are having bilateral lobar pneumonia, that one, for 10 days. Okay. Bedridden 7 years following road traffic, and this is, you have to highlight it. Then you are registered order to lobar pneumonia and death certificate. So those are the important things, right? So then incorrect, this one also, right? So then you think what is the best answer, because these questions are very difficult. In a stressful situation, you will go for a wrong answer easily, right? 48. You are an, sorry, 12. This is from our 48 question from our 100 single best answer questions, right? I forgot to remove it. You are an intern at a medical ward. A 74 years old patient present to you and complained of general symptoms and loss of appetite. On your examination, you notice the following findings: thickening of palm and soles, white lines of the nails, small dark pigmentation of the patches of the skin. Which of the following poisons is most likely show these above features? If you know the answer, just 10 seconds. If you don't know, you can't answer, right? So we discuss those things, heavy metal poisonings. We discuss about the copper, mercury, arsenic, thallium, lead, everything, where those most important things which are related to these poisons, right? Out of those things, thallium usually causes alopecia. Then if you get a this kind of scenario, they will add alopecia to that. Lead, that is hematological malignancy and the X-rays. Copper, that is related with encephalopathy. Uh, and the arsenic, when it comes to arsenic, you know the answer. We discussed the most important things related to arsenic poisoning. Cyanide, that is a cellular poison level thing that is not related to these type of long-term symptoms. That is a quick death. Arsenic also has a quick death, right? But this is permakeratosis. This is meseline. This is teardrop skin. You know those things. We discussed those things in our lectures. So those are related to arsenic poison, right? We discuss, heavy metals. Under heavy metals, these things we discuss pesticides. Under that, we discuss the weedicide, insecticides, those things, those most important things. So you have to go through those lectures, and rather than we are telling those lectures, they are just uh, kind of summary related to the most important clinical findings, where they will put this type of question to your exam and check your knowledge. Why we are discussing these things? You have to work in let's say in Anuradhapura Polonnaru area, where you have to go through with these type of scenarios. And these arsenic poisoning is also there. There are theories, several theories. So these things you can appear when you are working as an intern, post intern. So that's why those are clinical issues, right? 13, which statement is false? Again, false regarding the brainstem death, right? We discussed 3 head injury lectures, where one is related to the meninges and those things, and the skull fractures, and the internal hemorrhages and those things we discussed. And in addition to that, part is for the transplant act. So there we discuss these things, right? Brainstem death, right? Gag reflex used in brainstem confirmation. Yes, if you go through the transplant act or our lectures, you can answer this well. Gag reflex used in brain death confirmation. Yes, true. Brainstem death confirmation is described in transplant act. Yes, a famous statement. Yeah, this is usually you will get. Yes, that's true, right? To give proxy consent for transplant, the donor must be above 21 years old. Yes, that's true. If you are giving your organs after your confirmation of the brain death, you can give the consent now, and later once you suddenly, let's say, following a road traffic accident, brain death confirmed, you can donate your organs, your own organs. That is, the person should be more than 21 years, not 18 years, right? Next of kin should be more than 21 years or to give the consent of the organ donation. That's false. Why? Next of kin above 18 years. Let's say a person who is a male person who is 22 years old, then the married wife is 19 years old. Let's say the 22 years old male was following a road traffic accident. Uh, they the doctors confirm the brain death, then the 19 years old next of kin can give the consent for the organ donation, right? So that is the mention in transplant act. This is false. This is 18 years, right? The Babinski reflex cannot be used as an additional reflex. That is true. Babinski reflex, that is developmental in pediatrics, using that kind of one. So if you know the theories, you can answer these questions well, right? So this is the what is the false one? So this is the false one, right? 14. Which statement is false regarding the consent? Remember, false, then they are asking the correct one, right? Okay. Those above 16 years old can give the consent for sexual intercourse. Remember that 16 years female, okay, not the male. Males cannot give, let's say male above 16 years can give the consent for anal intercourse. That is false. Homosexuality is prohibited in Sri Lanka. So male, not males, only the females, right? Under 18 years, in generally this is true, right? Under 18 years of age cannot give consent for the surgery. Yes, that's true, but in specific situations, Gillick competence, we discuss those things in consent ethics lectures. Sometimes, let's say 17 years, that is we in a situation where there are no guardian, there are no any relations, no parents, no next of kin. In that kind of situation, towards the best interest of the patient in an emergency, we can take the 17 years old as an mature minor, and you can take the consent towards the best interest of the patient, but that is rare. In generally, this is true, right? If the consent is not obtained, it is always considered as a criminal offense. That is false, right? That is the answer, I think. Let's go to the other ones, and remember, consent is not required in a court order cases. Yes, that's true. When it comes to court order, mental health act, you don't need the consent. SLMC can start an inquiry for the if the consent has not been taken. Yes, that's true. If the consent has not been taken, you can SLMC can start an inquiry. That is true. This is true. So this is false in a emergency situation. You don't need the consent. If the patient is unconscious, you don't, without the consent, you can do as best interest towards the patient, right? So the answer is false. This is not perfectly true, but when it comes to the best one, this is the false one, right? 15. You are an intern at a surgical unit. On your on-call night, a 30 years old man is brought to the surgical ward by the police after being arrested. He was found unresponsive in public toilet on examination. Drowsy, GCS 10, pinpoint pupils. Respiratory rate is 6 breaths per minute. Pulse rate is 55. Blood pressure is 90/60. There are multiple old and fresh needle marks on his arms. This is an easy question. Which substance is most likely to cause his presentation? Alcohol, pupils, these are pinpoint. Alcohol usually dilate the pupils. Alcohol, no. Cannabis partially dilate the pupils. This is if you go through pressure drop, bradycardia, this is respiratory depression is also there. Pupils depressed, drowsy, everything is there. That is more towards CNS depression. Let's say the pulse rate is high, then the BP is low, then that is because of kind of hypovolemia, that kind of situation. So the go through all the parameters and check whether what happened to these things. These are everything goes down. So that means this is bradycardia and hypotension. This is more towards CNS depression, right? Cannabis, usually it causes dilated pupils, slightly dilated. So the pinpoint pupil, that is false, right? LSD, everything increase, right? Not LSD. Heroin, yes, that's true. Methamphetamine, that is also methamphetamine means we discuss those things in under narcotic drugs. And methamphetamine is a CNS stimulant where it increase the blood pressure, increase the heart rate and everything. So these are again the needle marks is there. So easy. That is heroin, right? So answer is heroin. Okay, you are an so these things are important when it come to the MD level. These things also important found in a public toilet, right? Where this discussed those and he found to be on a public toilet. So the cannabis is highly unlikely because the people who are using those elite group is the people who are using cocaine. So the cocaine can be if the cocaine is not here, but if the cocaine is there, this is a hint for the cocaine, right? The people who are using cocaine is not in a public toilet or somewhere, right? You are an intern at a medical unit. A 17 years old girl is brought to the ward by the teacher at her school with her history of a suicidal attempt after eating fruit from a tree that an argument with her boyfriend. She complained of abdominal pain, repeated vomiting, and faintishness on examination, right? So remember that 17 years old girl after teacher history of suicidal attempt after eating a fruit, right? Fruit from a tree. So those are important, right? Pulse rate reduced, BP reduced, ECG shows T inversion, second degree heart blocks, EC, ST depression, renal function normal, liver function normal, right? Right, which of the following are most likely to cause uh, these findings, right? Richness communicus, that is endo, so that is usually GI symptoms. We discuss those things in our, where there are separate things which related to the GI, where the gloriosa superba, richness, because precarious, everything GI. So richness communicus, again endo, that is seed. Usually the seed is the poison one, so that is endo. Arbus picatorius, again the seed, that is and GI symptoms. So the Adenia palmata, that is goes to the cyanogenic group, where the cyanide, it is cellular poison. Tevetia peruviana is Canero, that is the poison is cardio related poisons are there. So the datura stamonium, that is athana, that is atropine, that cause tachycardia and hypertension and those things, not related to this type of, when it comes to the cardiogenic symptoms, cardiogenic glycosides that related to the heart blocks and everything, that is Tevetia peruviana, Caneru poison, that is fruit, usually the fruit and the seed, where this clinical scenario is highly matched with suicidal attempt with fruit. So the suicidal attempt with tablets, that is usually Panadol, right? So this clinical scenario, 17 years old after argument with boyfriend, tablets, usually Panadol, right? Okay, the last one. Which statement is false according to the Sri Lankan law, right? False. Exhumation can be ordered only by magistrate. Yes, exhumation only by magistrate. We discussed the things which related to the inquiry system in Sri Lanka. That lecture, separate lecture, where the magistrate has those powers. We discussed those things. Those about 14 years old can work as a domestic servant. Yes, that's true. The one government tried to increase it up to 16, but it not in the legislation yet. Still, it is 14, right? ISD can summon a consultant. Yes, we discussed ISD has the magistrate powers, but he cannot give a verdict, so he can summon anyone. He can summon a doctor, he can summon an intern, he can summon a consultant even, right? Loss of a nail is a grievous hurt. Usually, loss of nail is not a grievous hurt. That is not taken as a usually not. But when it comes to the loss of nail, can cause infection, ascending infection, and there can be osteomyelitis. Those things you can elicit in kind of a rare scenario, but usually not. Right? Cerebral concussion is categorized under endangering life. That's true. Why concussion can cause asphyxiation and aspiration features. We discussed about those things in a separate lecture, where the type of concussion, there are gradings, cerebral concussion and mild concussion. What are the American Association of Neurological gradings? We discussed those everything, right? So the this one, exhumation, yes, that's true. This is true. This is true, and this is false. Usually that is false. This is again true. So they are asking the false answer. So the answer is answer D, right? Remember that above 18, this age above 18, that is we call an adult. Above 16, females can give the consent for sexual intercourse. Above 14, male or female can use as a domestic servant. above 12, sorry, below 12, we are taking that there's no ability to do a perform a rape. Below 8, there's no any criminal responsibility where there are no any criminal mental maturity, right? So that's the basically the age, and there's a one law in the Muslim law that is not important for you. They are the about 12 can marry or something is there, but that is I don't know whether practically that is happening or not. Where if the Muslim girl is less than 16, the police will bring the both parties as that is not according to the law, and they are saying that, right? I don't know about those things well, but in Muslim law, they are saying that about 12 girl can marry or something is there, right? So, but that is not in legal setup. So don't worry about that. So that is how the age are going 8, 12, 14, 16, and 18, right? So that's all. This is the type of questions you can get in your single best answer type questions. If you have any answer questions, you can send a message. As I mentioned earlier, um, not like those messages where the what are the plant poisons in Sri Lanka in the morning. If you send that kind of message, I don't have any time. We don't have any that much of time for answer that kind of question. That is a separate lecture. If you either from our lecture series or whatever from anywhere, you have to know those things. If you ask kind of a related question, we know how depth you are asking that question, that kind of what are the heavy metals poisons in Sri Lanka. So that kind of question we can't answer that type of question. If you have a differentiation, like if you go through your degree and you know the basics and you are asking kind of that one question, one student asked that sulfuric acid inorganic or organic. So those are, we know, then he went through all the things and he know up to a level and he's having a kind of logical doubt, right? So that's how we are going to, so happy to help for those type of people, right? Okay. Okay, then thank you for listening. Right. What is this? Okay, right. Very good. Arun is there. Okay, then. Study well. Good night.